So we're here with Danny today, and he is doing a senior massage, and he's going to talk to us a little bit more about what senior massage is about, and all the information and how he was trained, as well as the benefits of senior massage and why someone would get a senior massage.
Geriatric massage can be a lot of different things, but basically what it is to be able to assess and to plan and to carry out massage for senior citizens or people who are exhibiting senior citizens symptoms, such as even could be used for those who are disabled at an early age. But the assessment part is to be able to look through intake forms to see what kind of medical problems the person might or might not have, what kind of medications they're having, the current status of their health, what kind of symptoms do they have. When a person comes into me as a client who has some age on them, they're going to come in one of three different stages. They could come in as a robust individual who needs absolutely no differentiation as far as massage from any other individual that comes in. They may not have any aches and pains, they may not have any medical problems, they may be just completely no different than anybody else that walks in the door. In that case, you just plan like you would any other massage patient and carry out your massage accordingly. Most folks that come in are exhibiting age-appropriate symptoms, such as maybe slight or medium arthritis, or maybe they might be diabetic. They may have some sort of vascular problems like varicose veins or nerve problems like neuropathy that a lot of times accompany diabetes. So a lot of times what you'll have to do is you have to change your plan as far as all those folks is concerned. I'll show you several different things today that may accompany different types of ailments. Today we'll look at someone who has, just say, diabetes. What symptoms comes from diabetics? Well, first of all, there's circulatory problems and nerve problems, especially with the extremities. On top of that, you may have a person that may be easily bruised. As we grow older, the adipose tissue underneath the skin, or the fat tissue under the skin, disintegrates little by little, and we'll notice that out of nowhere comes a bruise because it just doesn't have any cushion there anymore. So on the top of everything else, you may have a bruising problem, a nerve problem, and a circulatory problem all at the same time. Therefore, you have to figure out some way to stimulate circulation without bruising and stimulate nerve activity all at the same time. So I'm going to show you some things that can be done based upon a bunch of different symptoms. I'm going to show you what could be done for a person who comes in who has diabetes, also has vascular problems. They may have complete veins dilated all over their feet. This person today, of course, does not. But in those situations, you can't manipulate the flesh. But you still need to stimulate the nerve system, and you need to stimulate circulation. So maybe the only thing you could do will be an action we call pumping, which means that you can stimulate the nerve system and the circulatory system just by pumping on the foot, and it increases both nerve activity and circulation. And when I'm talking about circulation, I'm talking about the blood circulating, which brings all of the oxygen and nutrients to the cells, and I'm also talking about lymph circulation. And the lymph system does two things. It picks up the waste after the blood has done its work. It picks waste out of the cells and dumps them out of the body. And it also carries your immune system with all your antigens and your antibodies to all different parts of the body. So it's really, really important that we keep that circulation going. So sometimes we may have to pump this 10 or 15 times if that's the only way we have of circulating the lymph and the blood. If we don't have those vascular problems, but yet we've still got somebody of age, we don't want to do any kind of traction, like on the toes or any kind of joints. We don't do any traction at all, but yet we want some kind of movement out of this. So if you'll come here, Lisa, I'll show you how we can manipulate the toes. Just by pressing on the ball of the foot, you can see how we can get movement out of the toes without actually pulling and doing traction on the toes. That way it gives us movement. It stimulates circulation in the foot. It stimulates the nerve endings. I myself am a diabetic, and I'm almost 60, so I'm relating to most of these folks because I'm there. I also have neuropathy in my feet, which could mean several things, but I have the typical tingling, either the loss of sensation or the increase of sensation. So you have to be able to adjust to that person to know what kind of pressure you can put on the foot, and also where to manipulate and things that you can do that you don't normally do to the everyday massage client.
So, Danny, if somebody is interested in getting a senior massage, do they need a prescription or okay by their doctor?
In most cases, no. Massage is okay for most situations without any kind of prescription or whatever, except for in certain situations. If the person has ongoing heart problems, or if the person has breathing problems, if a person has a history of phlebitis or blood clotting, any of those types of problems that will exhibit, then we probably need a doctor's okay before we do that.
So tell me a little bit more about how you were trained to do this. Do you have to be specially trained for this?
Well, it doesn't call for on your license. If you're trained in geriatric massage, your massage license looks no different from anyone else's. Most massage schools may touch briefly on geriatric massage. But I was trained by the Daybreak Institute of Geriatric Massage, which was created in 1982, I believe. And their sole purpose is to do research and treatment and teach other massage therapists how to work on this unique population, which, because of the baby boomers, is growing every day. So in 2003, I went and was certified by the Daybreak Institute in all things geriatric massage. How to assess, know who you have, things that you can do differently to get the same results. If I've got someone again that needs circulation, but they bruise easily, Daybreak has showed me what we call a fluffing technique, which means instead of doing the petrissage or manipulation of the muscles, I can still just do a fluffing of that muscle. It doesn't feel like a whole lot, but it's increasing the circulation in that muscle like 10 times what it normally gets. It's also